All right. Hi, everyone. This is Dr. Khraizat coming at you from Michigan Women's Care again. And today I happen to be in the hospital, and one of the nurses was asking me about her premenstrual syndrome, PMS. And she's very upset with her symptoms and seems to be very frustrated. So I gave her some advice and talked to her, and I thought maybe this would be a good topic because I know she is not the only one. So at Michigan Women's Care, we've been delivering excellence in gynecology and obstetrics for over a decade, and this is one of the conditions that we commonly see. PMS, premenstrual syndrome, is a constellation of behavioral and physical findings that affect the woman's quality of life. There's a lot of symptoms, but most of the bothersome ones are the behavioral or psychiatric symptoms that come with premenstrual syndrome. It is not an uncommon disorder. If you're a woman of reproductive age, which is from menarche, when you start having your periods, until the perimenopause, 75 to 80% of women will have some premenstrual symptoms, okay? One or more or multiple, but not all of those will have enough symptoms to affect their quality of life. When it becomes severe, or PMDD, premenstrual dysphoric disorder, that's only in about 3 to 8% of women, and it affects the quality of life. So that's when it can become really problematic for the patient. PMS does not discriminate against you based on your cultural background, your ethnic background, your socioeconomic status. It can affect all women of all types, and it's been described in most every culture in this world. So, and it's pretty common. The symptoms that are most bothersome, like I mentioned, are the symptoms of behavioral, and those include irritability, short-temperedness, easy anger, tearfulness, headaches, anxiety, tension, difficulty concentration, fatigue. Those are some of the most bothersome symptoms. The physical symptoms can be bad, but they're not usually as bothersome as the behavioral ones. But the physical symptoms include headaches, breast tenderness, joint pains, feeling like you're swelling, like your water retention, cravings, increased appetite, slightly increased weight during the PMS time. How do you know it's PMS and not something else? The key with this diagnosis is that the symptoms start in the luteal phase of your cycle. What is the luteal phase? That's the second half of your cycle. So about 10 to 14 days before your period starts. And the symptoms mostly resolve within the first couple days of your cycle. So it is a cyclical chronic condition. It happens on a cyclical basis, and it is a chronic condition unless treated appropriately. That's how you differentiate it from other chronic conditions like depression, anxiety, or other symptoms, hypothyroidism or anemia, or some other neurological abnormality that can explain some of these symptoms. It is cyclical, and it happens 10 to 14 days prior to the onset of the period and resolves within the first couple days after you get your period. That's the key to the diagnosis. If you have PMS, you never have symptoms between day 4 and day 12 of your cycle. So if today is your first day of your period, today would be day number 1, tomorrow day number 2, day number 3 after that, and then day number 4. Between day 4 and day number 12, you never have these symptoms. That's another way to differentiate it from other conditions. So it can be a very big effect on your quality of life, and you can come to the office and say, "Doctor, my hormones are way out of whack, and I want you to do some blood testing for my hormones so we can figure out if I have PMS or not." I'd listen to you and educate you about that, but a blood test is not indicated for hormones if you have premenstrual syndrome. Blood test does not diagnose premenstrual syndrome. A prospective diary for a couple months will tell me, or you just tell me your history, and if you have those signs or symptoms, it will help me significantly. The blood tests that we may consider include some vitamin levels and a blood count to make sure you're not anemic, and maybe a thyroid level to make sure your thyroid is in order. But you don't need hormonal tests, because a woman with PMS does not have hormonal deficiency or hormonal abnormalities. The reason the PMS symptoms have to do with hormonal changes right before your period, the 10 to 14 days before the period, but it's not because you're making the wrong amount as somebody who doesn't have PMS. It's because your sensitivity to those hormones is different than somebody who does not get PMS symptoms. And the sensitivity is most likely related to serotonin. You have lower serotonin levels in your blood because you're more sensitive to the progesterone and estrogen changes, and that's why you experience those symptoms, and that's why there's so much variability in the symptoms that women experience. So remember the word serotonin, that's the hormone that's involved, or the chemical that's involved. That will tie in as to how you treat this disorder and how to get some relief. So talking about relief and talking about management strategies, what can we do for you? The first thing is some conservative treatments like exercise is very important. Exercise multiple times a week, 30 minutes a day minimum, preferably 5 times a week or so, because that helps raise your natural endorphins and your natural concentration levels and your activity level and your energy level. So that's very helpful, but it's not gonna resolve all of the symptoms. There are some vitamin supplements that you can take, specifically vitamin B6, 100 milligrams per day should be able to help somewhat. Magnesium supplementation and over-the-counter supplement should be able to help a little bit. Learning some relaxation techniques like meditation, yoga, muscle relaxation, deep breathing, go into a support group might be able to help, because you are not the only one experiencing those symptoms. Let's say you do all that and you're doing wonderful with those, but you still have the premenstrual syndrome that's affecting your quality of life. Then it becomes a matter of medication. 2 major lines of medications that are available for treatment of PMS and or PMDD. Those are the serotonin, selective serotonin reuptake inhibitors, such as, I'll use their brand name so that they're recognizable: Prozac, Zoloft, Celexa, Lexapro, Effexor. Those medications are serotonin reuptake inhibitors. So that serotonin level that's low in your bloodstream when you have the PMS symptoms, these medications help prevent the cells from uptaking that serotonin so that it can be at higher levels in your bloodstream so you can feel better. That is the mainstay of treatment. The nice thing about these medications, although they're also antidepressant medications, we're not giving them to you for anxiety, we're giving them to you for premenstrual symptoms. So a lot of times the patient will do very well by just taking these medications for those 10 to 14 days prior to her onset of her cycle, or on the first day that she feels crummy, and then she continues to take that until her period comes, and then she doesn't need to continue with the medication until the next cycle is about to come. So it's an intermittent medication use, not a daily medication use, and that's very different from somebody using these medications for depression type symptoms. So that's your mainstay of treatment, and that usually helps about 75 to 80% of women who suffer from severe PMS or PMDD. The other line of treatment is birth control pills or a patch or a birth control ring. Those are off-label, so I want to make sure I mention that. But because birth control pills and the patch and the ring prevent you from ovulating, therefore they decrease the overall cycling or the changes, the significant hormonal changes that occur, especially if you take them continuously, which means like for 3 months at a time, so that you get a period once every 3 months instead of once every 28 days. That should help with your premenstrual symptoms. Only one birth control pill in the United States is FDA approved for PMS and PMDD, and that's Yaz, Y-A-Z, and that's just because it was studied for PMS and PMDD, and it does help by about 50%, and it contains a steroid called drospirenone, which helps to allow you to urinate a little bit more during the premenstrual phase so that you can feel less bloated and less water retention. It's a pretty good birth control option, and it's a pretty good medication for PMS and PMDD. But other birth control pills, even though they're off-label, should be able to help, or the patch or the ring, but off-label. And preferably in a continuous 3 months at a time, as opposed to a cyclic 28 days at a time. So those are the main ideas around premenstrual syndrome and PMDD. Don't forget to exercise and to learn about relaxation techniques and how to try to understand that this is your body's way of telling you that you're ovulating, and that it's a normal function that you go through cycling every month. But if it's affecting your quality of life and you don't like the way that it makes you feel, then please follow up with your doctor. If you choose to follow up with us, we'll educate you about this condition and what your treatment options are. And then You can follow up with us at 734-981-8181 or online at www.michiganwomenscare.com, and hopefully you'll be feeling better soon. Have a great day.